Good afternoon and thank you for joining us for today's coronavirus press briefing. I'm Caroline James in for Donna Bush. And a warm welcome to our viewers on CIG TV, YouTube, Facebook and our listeners on Radio Cayman. This afternoon's prayer comes from Pastor Olson Ebanks.
Shall we pray? O Father of mercy and God of all comfort, with thankful hearts for your faithful protection in the past, we come humbly to your throne of mercy again today, fully convinced that your will towards us is totally in line with your character. God of love and mercy, hear our prayers for these three islands and our people. We ask for your protection so that both the spread of COVID-19 and its impact upon our people will be halted and kept to a minimum. How can we ask for more? For we deserve nothing of your goodness. Guide our Premier, our Governor, our Minister of Health, our entire medical fraternity, both department heads and the rank and file, and protect those who are on the front lines and all who are most vulnerable and at highest risk from this viral pandemic. We pray that you will give revelation and wisdom to those who are working to find both a cure and prevention for this disease, so that lives will be saved and the hearts of people turn once again to you in worship. Again, we pray that we all will exercise both discipline and wisdom in our daily activities, so as to protect both ourselves and those around us from contracting this disease. For your mercy and grace, we give you thanks in Christ's name. Amen.
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 Thank you, Pastor. We're joined today by His Excellency the Governor, the Honourable Premier, the Honourable Minister for Health. We also have the Commissioner of Police and the Chief Medical Officer on hand. So we'll turn first to Dr. Lee.
Good afternoon. We have 13 results to report today, of which 11 are negative and 2 are positive. Both of the positive results, neither of the 2 people had any history of travel. I think it's important to say now, not only for this point, but also from the point of the extensive investigation that public health has been undertaken on the people that we've reported recently within the last 2 to 3 days, that we should accept that this condition, COVID, caused by the SARS-CoV-2 virus, is in our community. And I do implore everybody to please stay at home. And if you have to go out, keep your distance from people, keep those respiratory things to prevent respiratory conditions from spreading. Keep active with those. Keep your hands clean at all times.
Reshma Raghunath, Cayman Compass. So today you are confirming that we have community transmission. Is that correct?
That's correct.
So in relation to what the community should do, you said we should stay home. Is it a question of do we need to wear the masks now? Do we need to wear gloves when we go out? Because there are people who will be going out to get go to the supermarket, banks, so forth. What would be your advice to the community who need to go out now?
I think if people need to go out, if everybody does wear masks, and there is a supply issue, and I do recognize that, there's not even enough masks for me to go and say, can I have some, because it's just inappropriate. But there is a supply issue. But if everybody is able to wear masks, it will prevent that droplet spread, the gross droplet spread that might happen from one person to another should they perhaps be spreading, have the condition.
In relation to these 3 cases, can you share any information in terms of the place, the districts that they may be from, or any sort of details on their condition so that the public may be aware of that?
I know that one person was unwell enough to have to go to the HSA for treatment. I don't believe, and I need to check, but I don't believe that either of the 2, I mentioned 2 positives today, were admitted to the hospital.
In terms of the one inconclusive...
and as far as the sorry, Reshma, but as far as the districts are concerned, I think that goes back to the community acquired issue, really, in that the investigations of public health have shown that people have got such integrated lives, whether it be their working lives or their family connections, that we really have to consider that every area potentially can be affected because of the nature of the smallness of the island, that people travel right across the island to go about their daily business. So I'm not at the minute providing any localized information. I feel if we had more numbers then we could, but at the moment I'm not providing any localized information. But just to say, I'm not sure it matters because of if we're saying we have community acquired disease, then we really should protect, every community should protect itself with the advice that we've provided.
In relation to the new cases that you've announced today, and because of the high-risk categories, can you say if, I know you've provided this before, the age ranges of the patients. Can you provide us with any further information in relation to those?
As you work up the age range, if you look at any of the graphs, steadily from 40 onwards every decade, there is an increased likelihood that you may be worse affected by this condition, and it rises particularly and very much more severely as you become octogenarian and above. Any long-term condition really is an issue. So although the headline conditions are headline because they're the most common, so cardiovascular, diabetes, chronic respiratory conditions, that's only because of a frequency issue. But anybody with a long-term medical condition should take particular care of themselves. And of course, it's not them really, it's the people around them that need to be absolutely scrupulous with their hand hygiene and not to approach them too closely. You need to send your love from a distance.
Okay. Now, you know me, I always ask for numbers. So, taking into account today's cases, can you give us a round figure of where we are in terms of COVID-19?
More than the dashboard. I mean, we have 205 negatives to date, 14 positives to date. We're still awaiting that inconclusive result to come back from CARPHA. We've not heard anything from them. And we've tested a total of 220 people to date.
In light of today's news, I know a lot of people are going to be worried, they're going to be scared, knowing the results that you've shared today. What assurances can you give them, or what words of advice can you provide for them in relation to your announcement today?
I think if you can imagine yourself standing alone, isolated from everybody, there is no way you can catch the disease. It's spread by droplets. Just think of yourself as an island, and then go about your life considering you have to keep yourself an island and to keep that virus out of your little space. And if you do that, you'll be okay. I think that is the most important message, which is why we've gone to such extraordinary lengths to try to encourage the public to do that. I'm hoping they're coming on board. I still see a lot of traffic on the roads with 2 or 3 people in the cars, and I'm thinking, well, where are they going? Because it doesn't look like they're going to work. It doesn't, you don't need 2 or 3 people going to the supermarket. I don't know what's happening. But please stay at home.
Thank you, Dr. Lee.
Dr. Lee, I have a question for you joining us from Cayman News Service. As far as you can say with these new cases, how are the patients doing? Are they in isolation at home or in hospital? And how far have you got in tracking their contacts so far?
Yep. So as far as my information is concerned, all of the patients that are currently positive are either better or they're being isolated at home. We have Public Health has been doing an extensive amount of tracking and tracing and is able to understand the relationships. I mean, obviously it takes from when we get when a positive person, when we announce it, it then takes around a day in order to do all that work to make sure we understand everything. But we have very skilled people out there who are used to doing this contact tracing, and they're doing it very well.
And how are they doing? I might have missed that. Are they doing as well as can be expected?
Yes. So as I mentioned, I don't think anybody is currently an inpatient at any hospital with COVID-19. I know some people are unwell and they're at home, but a lot of the people who have had it in the past are now feeling a lot better.
Thank you.
Ralph Lewis, Cayman Times. Doctor, can you say if the test can show how long a person has been exposed to the virus?
How I don't fully understand. You say how long, or how long ago, or it doesn't. What the polymerase chain reaction test that we do, and this is the standard that's being used across the world, is really for an acute infection. So it can show when your viral load is going up, because it's merely counting the number of viral copies in the sample that's taken from your airways, and that's how it works. Once you have got over the infection, your viral load will drop and drop and drop and drop until eventually there'll be nothing left in your body, and the test machine wouldn't pick it up again. At the same time that you're beginning to recover, your immune system is finding a way to fight the infection on its own. So you've got immunoglobulins first, IgM, immunoglobulin M, and then IgG, which rise following an acute infection, and then the IgG goes on to give you longer-term immunity.
So you can't really say what stage a patient is at when you test them.
If you have the PCR plus the immunoglobulin test, there's more information for you to have than if you just had one on their own. Some of these immunoglobulin tests are now being approved, so when we get our hands on them, we are eager to get our hands on them. But I know, for example, the UK government has put an order in for, I think, 3.5 million of them, but hasn't got any yet. So it's a question of availability. But when we have those, we'll be able to better say what stage they are, or indeed, which is the really thing we really want to know, have they had the condition, and are they now considered to be protected against it?
Okay. The second question is regarding the students who have been in isolation. Their time is coming up for them to be released.
Indeed.
How are the health of the students, can you say?
I know that a few of them have been unwell and have been managed, but I don't believe anybody is in particular a problem at the minute. I think that those issues have resolved.
Will they be tested before they're released?
We don't currently have any plans to do that. We would follow the protocol that we're applying for everybody else on the island at the minute. If we had the ability to have much more widespread testing, because an order came in for huge amounts of reagents, we probably would, as we would also do an awful lot more testing, and there would be a group we would consider, but we don't have the capacity for that at the minute.
Thank you.
Thank you, Dr. Lee. Today is Tuesday, it's day 4 of the soft curfew. We turn now to the Commissioner of Police, Mr. Derek Byrne, for an update.
Good afternoon. No significant policing issues over the past 24 hours. The crime situation remains stable, and there is almost full compliance with the hard curfew between 7 p.m. and 5 a.m. nightly. Most of the traffic movements during the night curfew occur before 9 p.m, and these are associated with the food delivery services. Turning to last night in terms of enforcement and breaches of curfew, Little Cayman, no issues arising. Cayman Brack, 6 interceptions by police, no breach of curfew detected. Grand Cayman, 154 interceptions by police, 5 persons found in breach of curfew, all warned for prosecution. This included 2 persons who were arrested while driving under the influence and found to be over the legal limit, and who will be prosecuted separately for those offences. Looking at this morning's soft curfew, traffic today is flowing pretty well. I probably still have some concerns. There's more traffic on the road than there should be. We have strategic police checkpoints in place across the island. Business at supermarkets, pharmacies and banks continues to be brisk, but is being well managed and controlled. Supply lines remain open, and there is no shortage of stock being reported at the supermarkets. There's only a small amount of activity with persons out walking along the beach, and all are practicing social distancing. This is the message from our helicopter unit, who are providing overhead surveillance. Our helicopter and marine units are deployed on extended tours to monitor activities in the water and across the islands. Looking from 6 a.m. this morning, monitoring our traffic movements, 3 persons were found to be in breach of the soft curfew. All 3 were motorists, and all 3 have been warned for intended prosecution. Just 2 key messages today, picking up from the reports I receive from the command team on a daily basis. Drivers, please be aware of joggers, particularly around dusk, just before nighttime curfew comes into play. And joggers, please exercise extreme caution while you're out running, particularly if you're stepping off the footpath or running on the soft margins. Be very situationally aware of traffic movements. A reminder that the soft curfew, it precludes or excludes any marine activity, so therefore there should be no marine activity during the curfew period, and our helicopter unit and our joint marine unit are watching those activities with a view to enforcement, strict enforcement. I remind all, the hard curfew continues at 7 p.m. this evening until 5 a.m. in the morning. And if you have no business on the road as an exempted essential service provider, please stay off the road, stay home, Cayman. Thank you.
Good afternoon, Commissioner. Thank you for your report. I'm just curious, with the breaches that you've just told us about involving alcohol consumption, would it be maybe part of your thinking to recommend that liquor stores be closed to kind of reduce this particular type of incidents?
So at the moment they are an exempted category, and those conversations take place on a daily basis that will be managed at government level. I feed into the situation report on a daily basis, and that will be managed as we go forward. I mean, it's a responsibility on the individuals driving not to be driving while under the influence, as opposed to the licence holders.
Okay. Now, you said that there's still a lot of people on the roads. Even though you're saying there's still full compliance, we still see traffic at the checkpoints. Is there any plan by you to crack the whip a little harder on these people so that they get the message that they need to stay home, especially in light of the news that we received today about community transmission?
Yes, I think the news today does step it up a little for us. We're 4 days in now, and we have been promoting the message, stay at home. I certainly will look at it at my next briefing then, which is later this evening, and I think we'll have to do a bit more on the road in terms of enforcement.
Okay, thank you. Yesterday, Dr. Lee shared that he would have spoken to you about people who may be positive and or people in a household with a positive person breaking the protocols for isolation. Have you had any reports of this happening? And if so, or if not, what are the penalties if anyone breaks these protocols?
So I received no specific report of anybody breaking the isolation protocols at the moment. And the conversation with Dr. Lee is, how do we go to the next stage if this becomes an issue? And that is a matter of enforcement. And the penalties are there under the suppression law, under the public health suppression laws for persons who breach that. And that's a matter for us to enforce those. And we will enforce them. And we certainly will look at the suggestions put forward by Dr. Lee, and that's been looked at in NEOC, both in the morning sessions and in the policy sessions in the afternoon on a daily basis. In terms of the persons breaching curfew, that's a clear breach of the criminal law, which we're dealing with. We have a number of those persons who will be brought before the court for breach of curfew.
Just to help the public, with specific reference to the quarantine, the isolation protocols, what are the penalties under the suppression and control?
So the suppression law penalties are a fine of $1,000 or a period of 6 months imprisonment, which is completely separate to the police law and the curfew, the nighttime curfew, which is a fine of $3,000 and a period of imprisonment not exceeding a year.
Okay. Thank you very much.
One question for you, Commissioner. It's regarding the increased amount of trucks on the road, who I believe are related to the airport activity.
Yeah.
We're getting reports that they're speeding excessively. Would your officers be willing to monitor those and give some warnings if possible?
Yes, indeed, and I did receive one report this morning, and we did put a traffic unit in place. We will be speaking to the driver of those trucks. I know we've spoken to one already this morning, but we will be speaking to the contractor at the airport and to the truck drivers. They must exercise extreme care and extreme caution, and they have no exemption for speeding.
Thank you.
Thank you.
Thank you, Commissioner. Thank you also to our viewers who continue to send in your questions. A reminder to keep gov.ky/coronavirus, in particular the frequently asked questions page at the forefront of your browser, where many of those questions have been addressed in previous briefings. So we'll turn now to the Honourable Premier.
Thank you. Hello, everyone. I'll start today's briefing with my customary report on the progress of the virus through many of the countries in the world, particularly those where it is most active. Starting with the United States of America, total cases now are 174,834, up 11,046 since overnight. 3,408 deaths. That's actually more than China had. Up 267 overnight. Italy, 105,792 cases, up 4,053 overnight. Total deaths, 12,428, up 837 overnight. China, Spain, 94,417, up 6,461 overnight. Total deaths, 8,269, up 553 overnight. China, someone asked me yesterday to report on China. 81,518 cases, only 79 new cases overnight. Total deaths, 3,305, up 5 overnight. The United Kingdom, 25,150 cases, up 3,009 overnight. Total deaths, 1,789, up 381 overnight. And New York State, 76,795 cases, up 8,470 overnight. Now at 1,550 deaths, up 208 overnight. So the picture, with the exception, the notable exception of China, continues to be grim and becoming more so. I want to talk a little bit about the announcement of the air bridge, which has caused significant alarm in the community and has stressed me massively over the course of last night and this morning. So I want to say a few things about it. One, the purpose of the air bridge is not principally to bring people back to Cayman. Its purpose was essentially twofold. One, to bring much needed PPE and other equipment to Cayman. And secondly, to allow the opportunity for persons who, given the situation, which is becoming clearer and clearer that Cayman will not reopen anytime soon for business, particularly in the tourism trade, to allow people to leave Cayman. Once they get to the United Kingdom, many people can then get a flight to their homeland somewhere else. There are a significant number of people here who want to leave, and we are encouraging them to leave. The less people there are here, the easier, in general terms, it becomes for us to manage this crisis. The other point I want to make is that the persons who are seeking to come to Cayman are all either Caymanians, students, or persons who have a right to live here. It is very, very difficult, if not impossible, to tell people who have a right of residence in your country or are citizens of your country that they are not allowed in. I've said to many people, if those students in particular were your children, would you feel so strongly about blocking them from coming to Cayman? The other point I want to make is anyone who arrives in Cayman is going to be subject to a mandatory isolation in a place other than their home under strict monitoring by the government. Anyone. So anyone who gets on that plane to come to Cayman must understand that they will go into mandatory isolation for a period of 14 days. Let me just talk a little bit about the students who are in isolation now. We have no reports of any of those young people exhibiting symptoms of COVID-19, and none of them have tested positive so far, and we're almost at the end of their isolation. Given what Dr. Lee has said today, that we are now absolutely certain that there is community transmission, I want people to understand this. There is far greater risk of you contracting COVID-19 in Cayman from going to the supermarket or to the bank or hanging out with folk than it will be of you contracting it from persons who are mandatorily quarantined for 14 days. The point I'm making is those persons who are currently isolated, the students, and those who will come and will also be isolated for 14 days will pose a far less risk to this community than individuals who move about freely, not practicing social distancing and hanging together in groups. Those are far greater risks, far more likely to be vectors of COVID-19 than persons who have been isolated or will be isolated for 14 days. The point that we have been making ever since is we all need to stay at home unless it's absolutely essential that we go out. We need to wash our hands frequently. We need to practice social distancing. That is the only way that we are going to avoid this becoming a massive crisis akin to some of the countries, that I have just read the results about. So rather than people obsessing about the potential of students and some others returning to Cayman, we need to obsess about what we are doing, how we are living when we go out unnecessarily running up and down on the roads. I don't know where people are going because most places are supposed to be closed. We need to stay home. The other matter I would like to address is what the government is doing in terms of assisting vulnerable persons in need. So the NAU, the Needs Assessment Unit, which is a unit under the Department of Children and Family Services, has paid an additional stipend to persons on permanent financial assistance, seamen and veterans, in the amount of $425. We paid that on the 27th of March. We have extended approval for continuing assistance to all existing and known NAU clients for 3 to 6 months. We are currently providing services and assistance to 1,653 families, consisting of food vouchers, rent, utilities, and permanent financial assistance. Of the families being served, some 60% are elderly. We have 81 new applications for families which have been received and are being processed. DCFS, some of their staff have been redeployed to work with the students who are currently quarantined. The residential facilities for seniors and disabled, both in Grand Cayman and Cayman Brac, continue to operate at 100% to ensure the needs of residents are met. MASH services continue to be in operation to ensure all child safeguarding issues are addressed. Regular contact continues to be made with the children in care and foster placements, families and seniors in the community. The department is also assisting seniors with ensuring they get refills for prescription medication. And we have also worked at distributing COVID-19 flyers to the elderly. The DCFS staff continues to coordinate with other entities and to collaborate with voluntary organizations, businesses, private individuals, and community partners who are donating meals and food and hygiene supplies. Also collaborating with pastors to encourage congregations to conduct check-in on elderly in their respective communities. Also collaborating with neighborhood watch associations to do checks on the elderly neighbors, always practicing proper social distancing protocols. We're in the process of developing a hotline for elderly persons to address their specific needs and concerns. Emergencies, as always, should continue to be reported to 911. The additional support to non-Caymanians in need, which we announced some time ago, will begin on the 1st of April. It's a one-off food vouchers for $150 being considered for work permit holders in immediate need. Applications will be accepted for review and consideration starting on the 1st of April. Vouchers will provide interim support over a 2-week period to those who qualify until the airport reopens and or they are able to resume their jobs. The application forms can be downloaded at www.mcays.gov.ky. Alternatively, forms can be collected from various supermarkets and gas stations in Grand Cayman and Cayman Brac. Completed forms should be emailed to CIG COVID support at gov.ky or left in the drop box outside the Customs and Border Control offices, formerly the CIA Immigration Headquarters on Elgin Avenue. Contact number is 244-8000, Monday to Friday, 10 a.m. to 4 p.m. We encourage employers to continue to assist their employees insofar as that is possible.
Thank you. Your Excellency.
Yes, thank you. Thank you very much. I first want to refer to where we are on the sort of medical side of things. I mean, yes, today we have 2 more positive cases, even though we're not seeing lots of cases and we're certainly not seeing people who are seriously ill. But we do have now evidence that there is community-wide spread, which we've said had to be the case for quite some time now. And we continue to give the message that the safest place to be is at home. So please do follow all the advice seriously. But it's also worth saying that the very radical, drastic and early action taken by government does put us in a very good place to isolate any cases that now pop up, to do the tracing of who they've had contact with, and to do everything to suppress further spread. So we are in a good place to tackle any cases that emerge. But it does again underline what we've said repeatedly, that all of us need to limit human contact to the extent possible and really make an extra special effort to protect and look after our elderly and vulnerable people. On the curfew, just to say again, I think that's going very well. Thank you to the Police Commissioner and everybody involved in that, and thank you again to the community for the cooperation on the curfews. We absolutely need that to continue, and I hope people will step that up even more after today. On the British Airways flight, I think the Premier has put it very succinctly and very clearly, and I fully endorse everything that he said. And of course, I am very aware of concern about anybody returning on that BA flight. But I think we've made it very clear that if anybody does return on that flight, it will be properly supervised, a 14-day mandatory quarantine in probably the comfort suites, and that will be a condition of travel. But I do have to say that these are also Caymanians, and where there are genuinely compassionate cases of people who need to return, we do need to show some heart, and we do need to show some humanity in dealing with those cases. The UK has just spent £75 million chartering aircraft to bring its nationals back to the UK. We should be able to bring in 20 or 30 people who genuinely and compassionately need to return to Cayman. And I don't want to lose sight of the fact that this flight will help a lot of people who want to leave our islands, and it will bring in some much needed equipment. So just to say again, please do follow all the advice. And I finally want today just to say a big thank you to all the people out there who are manning our helplines. There are a number of helplines. This is a very stressful situation, and all of us will feel fearful and will feel concerned. We like certainty as human beings, and this situation provides nothing but uncertainty. And so it's right that we all feel anxious, but there is support and help out there. So my thanks to all the staff and the volunteers on the various helplines. That's the Emergency Travel Helpline, the Needs Assessment Unit Helpline, the NEOC Helpline, the Mental Health Helpline, and HSA's Flu Help Hotline. My thanks also to the Cayman Islands Crisis Centre, who are keeping their shelter open during what I know is a very challenging time for victims of domestic violence. We've said that being at home is the safest place for each of us right now, but this often isn't the case for victims of domestic violence, and I do pay tribute to the work that the Crisis Centre are doing to be there for people who have concerns. Thank you.
Thank you. Minister.
Thank you. Good evening. Grand Cayman, Cayman Brac, and Little Cayman. Before I start, I mentioned yesterday about the self-assessment tool. I'm happy to report that 800 such persons used this tool last night, and 721 of those were Caymanian who used the tools, and they were from 14 different countries. I want to say thank you to e-government and the Ministry of Health for putting this tool together. A few days ago, I spoke briefly about some strategies the Health Services Authority are implementing to prepare for coronavirus. This included a COVID-19 action plan, a special hospital operation team, and a multidisciplinary task force of clinicians. Today, I'd like to walk the public through that plan. COVID-19 task force at the HSA has now implemented the interim clinical guidance, which advises the clinical teams how to manage hospitalized patients with severe acute respiratory infection when COVID-19 infection is suspected or confirmed. These guidelines have been developed based on recommendations from the World Health Organization, CDC, Public Health England, Health Canada, and the European CDC. This is crucial as these people will be amongst the most vulnerable to the disease. The clinical teams have all been trained and will be following these guidelines, which includes, but not limited to, triage of the patient, infection prevention and control, management of respiratory distress, and special care for vulnerable persons such as the elderly, pregnant, mothers, babies, persons with cancer, those immunocompromised, and those undergoing dialysis. The task force meets at least once per day, and I am proud of the work they have done so far and will continue to do while we work to contain and eliminate this virus. As I mentioned yesterday, I'm pleased with the encourage the private and public healthcare providers to collaborate and support each other during these exceptional times. The people of the Cayman Islands can be assured that our healthcare practitioners and leadership are making all the arrangements to ensure health and the well-being of all residents of the Cayman Islands. On a separate note, for those of you who have so far sent in your jingles, thank you. We look forward to receiving more. The country looks forward to hearing your musical inspiration at this time. Lastly, I challenged the country a few days ago to rise to the occasion by pledging to live by the principles of putting others first, to remember we are brothers' keepers. I'd like to reiterate that message today. I've heard so many stories of the community rising up and acting to help those most in need. You all are an inspiration. Please keep up the Caymankind spirit. Please visit www.gov.ky/coronavirus for all your updates, including guidance on how to most effectively and safely assist those who are most in need. Also, I would like to mention that today is the 31st of March, and it's the closeout of Honoring Women's Month. As we come to the end of the month of March and the formal closeout of Honoring Women's Month, I wish to take this opportunity today to salute all of our women and to especially thank some amazing women leaders under my ministry and to highlight them for their hard work and dedication. They are Nellie Pucci, Acting Chief Officer, Minister of Health; Lizette Yearwood, CEO of HSA; Judith Seymour, Director of Counseling Center; Gina Petrie, DOE; Marcia Matu, Director of CNCF; Dr. Peggy, Director of Museum; Natalie Urquhart, Director of National Gallery; Brenda Watson, Acting Director of Drug Council; Dr. Hazel Brown, HSA, and the PA, Ms. Sharon Roberts. Sorry if I miss anyone, but I salute you. Moving on, I just want to pick up and note on what Dr. Lee said earlier and the question asked about masks. And I know there's going to be a mask frenzy, which in my personal opinion, I think masks are the way to go. And hopefully, with some of the work that Governor is doing in trying to get supplies here, that we can get more masks, that we can actually distribute them out in the communities, etc. And with some of the other shipments that we have coming in. I'd say to you, when we talk about masks, is to just pretend it's everywhere, like Premier has been saying. I want to also shout out the NAU staff who are doing a great job during these times and ought to be recognized. I also want to shout out the hardworking EMT staff. You're doing a great job and ought to be recognized. Also, I want to mention that when it comes to the HSA staff, everyone there is necessary, especially when we're waiting and preparing for this pandemic to heighten, and it will heighten. We see it's coming into spread now. So even the HR personnel, the housekeepers, I'd ask the officers to ease up on them. They're all important for what's going on at the HSA, and I know the commissioner is going to help me with this. And on a light note, I wanted to mention that how 1 year could change things. As you've been seeing, what a thing. In 2019, we said to stay away from negative people. And in 2020, we are saying stay away from positive people. Go figure. But I also want to remind everyone about this is day 2 of fasting and prayer. and hope you did it again today at 10 a.m. and tomorrow again. Also, in my effort to reach out to as much persons as possible, I spoke a little Spanish and Filipino or Tagalog yesterday, and I am most grateful that these communities responded with such confidence. And this is what we're trying to do: get the information out that everyone understands what we're trying to do in having people stay home. And thank you for having confidence in the government as you sent yesterday. I thank you to the Hispanic and Filipino community for listening and for sending your thanks. Today, my effort in translation will be for the Jamaican community and the Italian people here. The effort is to plainly say, please stay home unless it's essential. In Italian, it's per favore, resta a casa, a menoce non sia essenziale. And in Jamaican, it's do. Please turn your yard if you want to live. Mas Claude say it's not so pretty out there. And I also wanted to note what I mentioned yesterday about some atheists. And I just wanted to note this because it's very important when persons hear me and hear the prayer when we start the press conference. Well, there's an Italian doctor named Dr. Lulian Lorenzo said, I was an atheist, but now I'm returning to God. I pray for us to help take care of the sick. And this is during the coronavirus situation, as he's one of the doctors there. So, ladies and gentlemen, I thank you and God bless. Before I go, I want to say Psalms 86:17. Give me a sign of your goodness that my enemies may see. So the enemy is the coronavirus. That my enemies may see and be put to shame. For you, Lord, have helped me and comforted me. Thank you.
Thank you. Minister, you've actually answered one of the many questions that was coming into us there, which was about the linguistic update for the day for others in the community, so thank you. A question first for the Premier from Cayman News Service. Some CNS readers, particularly those who work in the tourism industry, are saying they've applied to the NAU that you referenced in your update, the Needs Assessment Unit, and have then attempted to make contact with government to no avail. Can you say how long people are waiting on average to get help? And a follow-up part of that question is, how many new applications has the office dealt with and granted since the port closed and tourism began to be locked down?
I can't answer all of the question. I did say when I started that they're dealing with 81 new applications which are currently being processed. That's all the info I have with respect to that.
Thank you.
And I should say that it's not simply a process of you submit the application and that's it. You have to be interviewed. They have got to make an assessment as to whether or not you qualify for the grant. And of course, this is not as easy as it once was because it's all being done by phone or online now.
Thank you. This one is for you, Premier. In light of what has been shared with us today, the results, will you be considering a more stringent clampdown on the community to slow the spread of the COVID-19?
No, the measures that we currently have in place are exactly what we need to have in place. I have said from the start that we need to behave in this community as though the virus was among us. I don't know how many times I need to keep saying that for people to understand. If people will comply with what's currently in place, there will be no need for any further lockdown. Stay home as much as you possibly can, socially distance when you have to go out.
Yeah.
That's all you need to do.
Now, in light of the BA flight, and you've answered a lot of the questions that we've had coming in, are there any figures that you can share with us how many people have requested to leave the island and how many have requested to return to the island?
No, I don't have the numbers as to how many people are asking to go. I just know that up until now we've had 121 requests to come over. How many of those qualify, I can't say at this particular time. But we will sort through those. It's all being managed by the Cayman Islands Government Office in London, and some decisions will be made as to those that qualify to return. We're certainly not bringing back visitors to Cayman. Absolutely not.
Okay.
I can just add to that because my office is helping on the demands from people here. There has been a lot of demand for people to leave, and that's all been processed. So I think we've also heard from a lot of people who would like to leave but are not able to. London isn't their sort of favoured route. So we're collecting all that information from people. But just to be clear, that there is a lot of demand for people to go on that flight.
I said yesterday that we expect fully that we will have to have some Cayman Airways flights as well out of here, because over the course of the next few weeks, I expect we're going to wind up with hundreds of people who come to the realization that not only do they not have work now, but it is unlikely they're going to have work in Cayman for some time to come, particularly those who are in the tourism industry. It's going to be a long time before tourism gets back up and running because of what's happening around the rest of the world. So even if Cayman, as God, I pray we do, is able to manage this situation with the virus so that it does not become, that there is not massive community spread of it, it's going to be a long time before tourism bounces back. And so the more people that we can get out of here, quite frankly, the better off everyone will be. Because if they don't have the means to look after themselves here, it means the government will have to do so. So we will afford them, to the extent that that is possible, such means as we can to help them leave, if it is possible. Subject always to the constraints that all around us, airports are closed, borders are closed, so it's not as simple exercise as we would like it to be. But it is going to get a lot more difficult for people here over the next week, couple of weeks, and going forward even tougher, particularly people who work in the tourism industry.
Reshma, if I could just add some breaking news, as I think you say in your business. So since I came down here, we've been in touch with BA this morning. So the flight will be to Bermuda and then to Grand Cayman and then back to London. But it will go back to London via Bahamas, and it will pick up some British nationals in Bahamas, a small number. And we're looking at Monday, Tuesday next week for that to happen. So that's just come through now, but we'll put something out and get that firmed up as soon as possible. Monday, Tuesday is the window that this flight will happen.
Okay, thank you for that update, Governor. We've had a number of comments come in, and I'm sure you have been getting them as well, for people, naturally scared for returning residents, returning Caymanians. Will you be subjecting these individuals to testing before they arrive here so that we ensure that they don't have the symptoms, even though I know it's asymptomatic? Of course, it's a bit illogical to say, right? But would there be any specific protocols before these individuals board the plane to come here that you can share with us?
I mean, I think there won't be protocols before people come, because the advice is if you have symptoms, you get tested. But I think the Premier was very clear, and I was as well, about the extraordinary measures that will be put in place to make sure that the returnees are isolated, in quarantine, supervised very effectively, as we've done with the first group. So we will not take any risks with the health and welfare of everybody on these islands. So the small number that do come back will be very effectively supervised to ensure that any risk is mitigated. Otherwise, we wouldn't do it.
We have gone to extraordinary measures, as Dr. Lee likes to say, to try to keep this country safe. I would hope and pray that everyone out there who's listening and watching it would not enter their head that I or the government I lead or the governor would do anything which we thought was risky in terms of increasing the spread of this virus in this community. We keep preaching what people need to do. The virus is in the community. We now have absolute confirmation. The persons that are coming are going to be subjected to the kind of isolation that I wish we could put everybody on this island into, lock everybody away in a room for 14 days. But we can't even get them to stay home. So stop obsessing about these people who are coming from the United Kingdom. There is far greater risk bucking up in your friend up in Foster's than it will be in getting the virus from somebody who's coming from the UK who will be locked away for 14 days.
I want to say, as Minister of Health, when this first came up, raise a red flag, and we see the comments from the community about their concerns. Obviously, they've applauded the government thus far in terms of the work that we have done, what we continue to do, and every day have a press conference to ensure that the public is well aware of what's taking place real time. If it was a situation where those persons were coming back and the then known self-isolation where you could either go home with mommy or daddy or you can choose to go to the hotel, in my opinion, I would have said no. But I'm very comforted with the fact that it's mandatory that they will be self-isolated or isolated at not at a place of their choice, at a place that has been identified by the government. So I'm very comfortable with that.
Thank you. I just want to, and this came in, I don't know if you've heard it, but there is a voice note that is being circulated that is aimed at work permit employees, telling them to leave the island. I know you have indicated that, this is what we really want them to do, but what assurances can you give to the community, the people who are on work permit, or advice to the community as a whole to not be prejudiced in this continuing situation? You've talked about not being prejudiced against those coming in. What about those who are already in the community and who may be facing these types of situations?
I'm not sure I understand that question at all. Persons who are here and do not have a job, if the opportunity affords them to leave, they should leave. They should return to their home. But in the interim, if they do not have a job, I have said more than once, the government will do whatever we can to ensure they have a roof over their heads, they have food to eat, and access to health care. But if you do not have work here and the opportunity affords itself, as will the BA flight next Monday or Tuesday, then you should do everything you can to get on it.
I appreciate that. I'm not talking about people leaving. I'm talking about in the interim until those measures are put in place. We've all seen the comments. We've all received the comments. I'm talking about the attitude towards each other within the community. That's what I'm talking about specifically, not the fact that they need to leave, but I'm talking about the interactions within the community between each other. That's the point I'm trying to get at.
Well, I've said more than once, we are all human beings. Unfortunately, all human beings are subject to prejudices and biases. That's why we have rules and laws in place. If I'm not prejudiced against you because of your color or your ethnicity, I'm prejudiced against you because of your religion or your gender. That's how human beings are. But in times like this in particular, we need to do everything we can to help each other and to understand that this is a global crisis. In Cayman, it is a community crisis, and we're only going to get through it if we all work together, live together, and try to help each other.
Alicia.
Felicia Rankin-Solins for Radio Cayman. Premier, this question is for you. As we know, as you've all said time and time again, times are tough and they're only going to get harder. And that means people, with time, their finances are going to begin to dwindle. So there are people who rely heavily on money transfer services who can't use them to receive funds or send funds to their family abroad, like Western Union. Is there any idea when those services will be available for people to use again in order to help themselves and their families?
Well, I don't think too much money comes into Cayman through the money transfer services. I think a lot of money leaves Cayman through the money transfer services. But a lot of people here have families overseas that they support and they help. We are very conscious that shutting the money transfer services, does cause significant hardship. The problem is that, again, the risk, the way those services operate, the risk of transmission of the virus is still very great. What we are prepared to do is, as far as I'm aware, we haven't had any representations from any of the services. If we have a plan which at least on paper looks as though the necessary measures can be put in place to limit close contact and risk of transmission of the virus, then of course the government will look at it. Initially we considered closing the banks, certainly the banking halls, and the Bankers Association came to us with a plan which has allowed us to be able to feel reasonably comfortable that there is minimal risk. There's always some risk, minimal risk of transmission, the way that they are operating their banking halls. And yesterday, we based on their recommendation, we introduced the alphabetical division of the community in terms of who can attend banks, again, to reduce the risk, because we I hope, have virtually eliminated the queues outside the door. So this is going to go on for a while. This state of emergency, if I may call it that we're in. And we know in the meantime people have to live. So we are not averse to looking at what can be done, but we need them to come to us and say, these are the circumstances. Here is what we think we can do to minimize the risk so that those can reopen. But based on the advice we had, we took the decision that we did. As I say, we're prepared to look at it again.
Thank you. That's all my questions.
Ralph.
I thank my colleague for asking one of the same questions that I had, Mr. Premier. And is there a contact number that they can call if they want information about when these money services will be opening up?
No decision has been taken to open up any money services. What we need is something from the services themselves saying, this is how we propose to address the risks that are inherent in continuing to do business in the current environment.
Right. And who can they contact? They can contact the government?
Curfew time at gov.ky.
Okay. One final question from me, and this regards customs waiver of storage fees. Is there a contact number that clients can call to see if they can arrange for some waiver of storage fees? I understand that they've been told that they have to pay those storage fees before they get their goods, even in this time. Is there a contact number they can contact to get information on whether the storage fees will be waived?
So why wouldn't they be required to pay storage fees?
That's the question. They're saying that during to these circumstances that with the curfew, that they probably should have those fees waived.
I don't know that any such decision has been taken
Okay.
to waive storage fees.
Thank you very much.
I'd have to ask.
That's the question.
I'd have to speak to the director about those things.
Okay.
As far as I know, everybody's required to pay their fees. If there are specific instances, people do this all the time. Send in a letter, an email, as the case may be, setting out what the particular circumstances are that you believe warrant a waiver of the fees. But there has been no decision to waive storage fees generally.
We'll take one more question from the media, and then if the panel have any further closing thoughts for us.
Thank you. I have like 10 questions that came in, but I'll try to pick the best one out
Thank
of it. You talked about curfew time, the email. We've been getting a number of requests and comments that a lot of the emails are not going answered. How are you managing with the emails coming in, and how much have you received? Because I know you talked about when you launched the Essentials, it crashed because of the numerous requests. So can you provide us an update on what's happening with curfew time at gov.ky?
But it's actually working incredibly well. We got a staff of 1, 2, 3, 4, about 8 people full time. I left them at 10 o'clock last night. Thousands of requests for exemptions. I mean, you would not believe the number of requests that come in. And the response that we've got, I mean, a lot of people don't like the response, which is generally no, but there's very little in terms of backlog there, in terms of answering the question, very little. I mean, if you write in today, you're likely to get a response tonight.
If I
You might like the response you get, mind you, but,
Generally.
but you get a response.
generally. If I may squeeze 2 in, I think it's critical to ask this in light of today's results. Would there be any changes to the protocols for, say, the delivery guys who are going out there from the restaurants and from the grocery stores to various places within the community? Will that be something that you will be reviewing as a priority, given the announcement today of community transmission being confirmed?
I don't know how many times I can repeat this. The protocols that we have insisted upon for the last couple of weeks are the protocols that need to continue to be observed, but even more diligently. Be very, very careful with what you're doing. If you have face masks and you want to wear them, fine. But as Dr. Lee has pointed out, unless everybody's wearing face masks, it's unlikely to protect you. The face masks are to keep you from projecting droplets to other people. It's unlikely to protect you in the event that somebody else sneezes on you. But many of the delivery drivers are wearing masks. Many of the people who are working in the supermarkets are wearing masks. That's all fine. Nobody's saying that you shouldn't or that you don't. But limit human contact as much as you possibly can. Stay a respectful distance, 6 feet away from everyone. And for those of you who don't need to be on the road, absolutely need to be on the road, stay home. It is as simple as that. The only thing the government, many more things the government can do, short of going to a complete and utter lockdown, which is for the length of time that we are talking about, or we know that we have to deal with this, is quite frankly impractical. It's impractical to try to lock the country. I get messages, 10, 12, sometimes a dozen a day. Alden, they won't listen, just lock them down. I wish it were that easy. The commissioner does too, but it isn't. So we understand that we're going to be in this for quite a while. You want me to guess how long? 6 weeks to 2 months. So we have to be able to live and to eat and to move around in a limited sort of way. So the government is very conscious of this. Believe you me, we are constantly reviewing. We listen to what people say. We listen to to the reports we get from the commissioner and from everybody else that's out there, and we are constantly thinking about what else we can do to limit people's interaction with each other without causing a complete and utter clampdown and become so restrictive that people simply can't live. If we could lock the place down in 3 or 4 days and then open it and everything would be well, we'd do that. I'd do it in a heartbeat, but it won't. We're going to have to live with this week, next week, and the week after, and the week after, and the week after. So we have to rely on people's cooperation, common sense, good judgment, and sense of self-preservation. If anyone doubted that the virus was in the community, no matter how many times we said so, we now have hard evidence of that. So behave as though your life depended on it, because it really does.
I think that's a powerful message to end on. I'll keep my other questions for tomorrow. Thank you.
Thank you, Reshma. Any closing thoughts from the Governor and Minister?
I mean, just to say this is a really difficult and challenging situation. All of us are feeling uncertain and anxious. But you know, I've been here 18 months and seen a community which really comes together, and we treat everybody fairly. Cayman kind is something that I hear all the time, and I see examples of it. So now is the time that we all need to show empathy and support and help everybody. Let's help everyone in our community to get through this. And when we will get through it, we just don't know exactly when.
Thank you.
I know parents are having a hard time, you know, working at home and trying to help their children with the school lessons, etc., online. And I just want everyone to pray for them and give them the strength to deal with this challenge. Hopefully, if everyone will abide by all the measures that we put in place, then we could get back to school. Our children can get back to school much quicker.
Thank you very much for joining us this afternoon. Thank you also to our sign language interpreter, Miss Carolyn Powell. Now, we've had so many questions come into us. A reminder to keep your eye on the FAQs section of the gov.ky/coronavirus page, which is being updated daily for you. There's also a Getting Assistance section there, and that lists all the contact details to help you with everything from medical questions to human services and emergency travel. Many of the addresses and numbers that were talked about today are on that page as well. Follow the Cayman Islands Government social media channels on Instagram, Twitter and Facebook for all the latest information, and we'll see you tomorrow with the next update.